This morning, coronavirus infections rising in 21 states.
The United States is reporting the highest number of deaths in a single day, nearly 1,500.
Hundreds dead, thousands infected across multiple continents.
He's lost 9 members of his family to coronavirus.
The biggest quarantine in history right now taking place in China. I think you're going to see that more amplified now.
It's usually a very busy street. Another beautiful day in quarantine.
Many hospital systems are simply overwhelmed right now, so accessing treatment, accessing equipment, accessing PPE, a lot of that stuff is just taking longer than it should.
2020 was a year like no other. A pandemic gripped the world with a death toll that continued to climb while upending lives, taxing the healthcare system, and crushing the economy.
It was crazy. And actually, MedShare, we were monitoring it early on. As the pandemic hit China, we actually started first providing PPE to China, trying to make sure that we can help contain it. But once it became a pandemic, we obviously had to shift. And as we saw the numbers continue to grow in the U.S., we did go, wow.
PPE became a household term and was in short supply around the world as frontline healthcare workers turned into our superheroes.
Typically, our model requires that we get surplus medical supplies, and we typically get that from hospitals, the large health systems that have surplus supplies based on regulatory reasons or new product introductions. So we usually partner with them to get those supplies and repurpose them to save lives. Literally, that's what we do. In this situation, the hospitals were running out of supplies. In fact, I never forget one of my first calls when this happened was one of my board members who was a Emory doctor saying, "Charles, I need help. We're running out of gloves. We're running out of masks. What do you have?" And they needed hand sanitizer, cleaning, disinfectants, and things like that. I said, well, we typically don't do this. And he said, but this is not typical. And I said, you're right.
So COVID has been a particularly big challenge for us, as it has been for everyone around the world. For us, it was testing and really, access to kind of reliable testing that we could get and be able to offer that broadly. We were able to be able to get that, thankfully, through the help of Jackson Family Foundation. Our percent positivity rate for that testing drive was about 20%, which is quite high.
Healthcare nonprofits weren't the only ones feeling the effects of the pandemic. Worry, fear, and stress were taking their toll on other organizations as major fundraisers were all canceled.
It's so hard to ask for money sometimes when all these other businesses are struggling.
This pandemic has really taken a toll on not just our nonprofit, and a lot of the money that's coming into this government is just not coming to us and some of the smaller nonprofits. We have about 67 veterans this year that we want to service.
Prior to COVID-19, our spring and summers were full with retreats. And so we had on the docket to do 26 retreats this year. Last year we did 23 retreats for families that are living through childhood cancer. And so we would do week-long beach retreats where we basically pull the families away from the chaos of treatment, away from the hospitals as a family.
You look at the way we learn, and if we didn't have a cell phone or a laptop or anything, we just kind of take those things for granted today. This is pre-pandemic, and then you add the complexity of a pandemic and realize that kids that already potentially were falling behind now, there's no path that doesn't include them falling behind without these devices.
There's 200 kids and we only have 75 computers. What are we going to do with the rest? How are we going to be able to handle that? How are we going to be able to manage to have these kids study at home and work from home? And this pandemic that happened right now, it really did put us right in the front lines.
But time and time again, Jackson Healthcare answered the call.
One of the amazing things about Jackson Healthcare, there's a key part of our mission that talks about improving the lives of everyone we touch. And the thing that is really unique about Jackson Healthcare is that it's not just writing on the wall, it's not just words. I consider myself extremely fortunate to be part of the Jackson Healthcare family, where that is lived, breathed every day into what we do, and it really is kind of living the mission about giving back.
We're just absolutely thrilled to have a relationship with Jackson Healthcare for no other reason that you know Jackson Healthcare gets it. They're in the healthcare space. They're trying to improve access to quality healthcare the same as we are. You know, so patient care is front and center as part of Jackson Healthcare mission, and to be able to align with them on providing that care to the community has just been great.
Jackson Healthcare has always been so amazing to our charity and so many other charities. They're also giving us volunteers to help work in the store, and that's a huge thing because this store is really going to be run by volunteers. We have one manager, and then everyone else is going to be, you know, helping us out.
It's been interesting in that to find out we share, you know, certain partners like the clinics that we support, and certainly I think you're aware of the work we partner with them on providing, you know, care to Phoebe Putney Hospital in Albany, Georgia, which was critical. Who would have thought that the epicenter for coronavirus in Georgia at one time was in Dougherty County, you know, in Albany at one point. And so we were very appreciative that you know, Jackson Healthcare stepped in and said we want to support that community. MedShare, how can we work together to do that? And we were able to do it. I mean, we provided upwards over 45,000 pieces of PPE.
It's been such an honor to be a partner with Jackson Healthcare and with an organization that really does understand our mission, our vision, our values, and our desire to really care for this vulnerable group of people. And the partnership is really what makes all the difference because we can't do this alone.
We can't do this alone. It's a village, and we need these organizations, and especially like Jackson Healthcare, who understands mental health and what we do. Anybody can write a check. Jackson Healthcare is hands-on.
The most precious thing in the world is time, and Jackson Healthcare shares that with us. Having Jackson Healthcare as one of the key supporters to us when we're in this crisis is important because it's not every day that you have a champion that wants to share the foxhole with you, that wants to be in the trenches with you. And Jackson Healthcare is one of those organizations that care.